And good morning, everyone. It's Jason here, Jason Shin. I'm one of the organizers of AIMOS2020, along with Alex Holcomb and Shinichi Nakagawa. We're sitting here at the University of Sydney in the Nerve Center. I'll just show you a lot of people helping us out. Because we're at the University of Sydney, that means that we are on the land of the Gadigal people of the Eora Nation. So I would like to acknowledge that and pay our respects to elders past, present, and emerging. We have an action-packed day. I don't want to spend too much time with this introductory stuff, other than to give some logistics and acknowledge the help of some people who have been very helpful. So in terms of that, a few bits of housekeeping. First, we have a hashtag, as you probably know by now. It's hashtag AIMOS2020. So if you're tweeting about this, please throw that in there. We're also doing a tweet up. So if you're on the Slack channel, you know that we have a running question. The first question being, how did you first get into meta research, meta science? We also have as I just mentioned, a Slack channel, which is amos-inc.slack.com. So please join that and join that bit of communication. We have things like if you're having any tech problems, there's a channel for that. There's also channels for most of the sessions. The website is great. It has the program on it, which is kind of like there's a sort of PDF version, which I have here. And there's also a dynamic Google Sheet, which hopefully works for you. And it has the links to all of the sessions. The sessions all have the same password, the same Zoom password, which is Merton, based on Robert Merton, well-known sociologist of science, and interested in making science more communal, which is something most of us probably agree with. Sarah Hancock made a great poster guide for the 3:30 poster session today. That's on there. You can see each poster's abstract as well as a 3-minute clip of the presenters talking about their research, and then you can click on the link and actually go and talk to them in person. Or they could maybe it's pre-recorded in a very clever way that makes you think that you're interacting with them, but if they pulled that off, then I think we should just be very proud of them. And finally, we have GatherTown open all day, which is cool little, almost like massively multiplayer online RPG thing where you can walk around and talk to people, and as you get close to somebody, you can start hearing them through their microphone. So it's pretty neat. And before I throw it over to Alex Holcomb, who will introduce our first speaker, Paul, I want to give a few thanks. First, to the generous sponsorship of UNSW and University of Sydney Charles Perkins Center, the generous guidance and support of the AIMOS Executive Committee, President Hannah Fraser, and a few folks who donated a lot of time and their expertise. Sarah Hancock, who some of you have probably interacted with on social media, who's we're beyond grateful for all she's helped with in coordinating this. Also Rose O'Day, Kat Vendel, Omid Gassemi, Fallon Modi, Mel Ross, and Rob Ross. And finally, Carla Viola, who's here, who's the sort of meetings guru at University of Sydney Law School. And without her untiring efforts and knowledge, we couldn't have done this. So I'll throw it over to Alex now, who will introduce our first speaker.
Thanks, Jason. It's great to see so many people here already. And thanks, Jason, for your leadership in organizing this. This is a good, nice war room we've got set up here as well. Thanks to Carla. So we've got an exciting lineup of a few invited talks this morning. And the first one is by Professor Paul Glasziou of Bonn University. He's professor of evidence-based medicine there. But you'll see that the schedule is such that we should wait for about 2 minutes before we start. So if anybody has any trouble now, they should maybe speak up in the chat or message us. The Slack is really the main place to be doing that. So I hope we're going to be, I see we're already seeing some messages in on the tech help channel of Slack. So that's good. We know that there are going to be people who don't have the password, but it's in the email that went to all registrants. When you join Slack, you'll automatically join several channels, the tech help channel, the social channel where we hope you introduce yourself, but there are also several other channels. There's a channel for most of the actual sessions, not this plenary session, but for all the other sessions, like the workshops, the hackathons, and the unconference sessions, you'll see channels, but it's a little bit, perhaps the weakest part of Slack is the channel discoverability is not evident at all to naive users. So you have to actually click on channels. Maybe and if you click on the plus thing next to channels, if you have Slack open on your computer, you can see a browse channels button, and there you'll be able to see the channels for some of the sessions you're interested in. Now, it's not necessarily the case that the leaders of the sessions will use that channel, but it's there if people want to chat and discuss things. So maybe we can get started now. So Paul Glasziou is professor of evidence-based medicine at Bonn University, and the title of his talk is Acting on Reproducibility and Avoidable Waste in Research. Go ahead, Paul.
Thanks very much, Alex. And can I just check that my full screen is now visible to you guys? Thanks, and very much thanks to the AIMOS organisers for the honour of giving the first of these mini keynotes at this session. It's a great pleasure to do this. And I feel like I'm in a somewhat different community. So my interest in reproducibility and waste has largely been in healthcare research. But at the Meta Science conference in Stanford last year, I realized that all science disciplines are going through this very similar problems. And I think particularly psychology has been aware of the problem, and there are leaders like Brian Nosek who are trying to do something about it. But it seems to be a common theme throughout disciplines around the world. But I'll apologize, the examples that I'm going to use and the framing of it is largely from the area of health sciences.
And Paul, I forgot to mention that we have a Q&A thing at the bottom for all participants to ask questions. And we're not sure about timing when we'll get to them, but depending upon timing, we hope to be able to field a question or two in the transition.
Thanks, Alex. And if people want to type those in as we go, because otherwise you have a tendency to forget, and we can come back to the Q&A at the end. So first of all, just to say that I'm very sad not to be in Sydney. I was born there and spent about 7 years at the University of Sydney. I believe there was a rumour that the organisers were considering copying this Parisian cafe for the social distancing to enable us to have it there, but there weren't enough giant teddy bears to be able to do this. So we're forced to do this via Zoom. Hopefully we'll all be vaccinated and be there next year. So just as a brief outline of my talk, I'm going to talk about the problems of replication and waste, some of the opportunities to improve, and some of the plans by different organisations such as NHMRC to try and address the increasingly recognised problems. I might begin with the so-called Begley's bombshell. There's a great book called Rigor Mortis about the problems of poor quality research. And one of the chapters is specifically about this paper that was published by Glenn Begley and Ellis in Nature in 2012 that I'm sure most of you have heard about. But the story of it briefly is that Glenn Begley was working at Amgen, was on cancer research, and they were looking at developing particular lines of research based upon key articles that had been published in the top science journals such as Science, Nature and Cell. But before they proceeded on that line of research, they wanted to replicate those key findings rather than building their house on sand. And so they attempted to do that, but they could only reproduce 6 out of the 53 that they attempted to do. And the majority of those, they actually got the original investigators to attempt to do it with their own reagents in their own lab, and they still couldn't get it to be done. And Glenn Begley would say that the major problem that he saw was that people had done things unblinded, and so with the key change that he would like to see is the blinding of experiments, particularly the outcome measures. But Amgen's experience of this is not unique. Interestingly, it was a very commercial decision though. They were doing this because of the potential amounts of money that they could invest in a line of research. And so purely for commercial reasons, they wanted to make sure they could replicate those findings. And we've obviously seen this sort of work in psychology and lots of other disciplines. But I thought I'd go back through a brief history of a slightly different framing of this, which is almost the same problem, though it looks at it from slightly different angles, is the waste in research. And go back to the late Doug Altman. Doug Altman was a statistician in Oxford who spent a lot of his career working in this area. And in 1994, he wrote an editorial in the British Medical Journal entitled "The Scandal of Poor Medical Research." It wasn't new to him then. He'd actually been working on this for decades, but this was his sort of his cry of pain. He said that there were huge sums of money spent annually on research that is seriously flawed through the use of inappropriate designs, unrepresentative samples, small samples, incorrect methods of analysis, and faulty interpretation. And all of those things are readily correctable. But no one quantified the huge sums of money for a while. And then Ian Chalmers, who's the founder of the Cochrane collaboration, and myself, tried to work out what the level of waste was, what Doug Altman's huge sums of money were. And I'll show you the calculation in a moment, but we worked out that roughly 85% of research is avoidably wasted. Of course, there's waste in research going down dead ends, but this was the avoidable waste, as Doug Altman had been talking about, with the avoidable flaws in the way that the research was done. And that would lead to probably over $100 billion a year being wasted in research. Then there was, as I mentioned, Begley and Ellis's article about their failure to reproduce top findings. In 2014, we did a more detailed version of the 2009 paper in a 5-part series on adding value and avoiding waste, which documented it in far more detail across a broader range, but still in the area of health and biomedical research. One of the upshots of that, which I think has been very important, is that we recognised funders as the people who hold the key levers in being able to do something about this, because they set the parameters on track records, how funding is distributed, etc. And so they, more than any group, funders have the power to change the problems that we see. They can't fix all of them, of course, but they probably have more leverage than anybody else. So in 2014, the AVEER Funders Forum was set up by the National Institutes of Health Research, ZonMV, the major Dutch funder, and PCORI, the Patient-Centered Outcomes Research Initiative in the United States. And now about 40 or 50 other funders around the world meet 2 or 3 times a year in trying to do something about the replication and waste problems. And the NHMRC here has set up the Research Quality Committee, which I'm fortunate to chair, and I'll talk about some of the work that that group has been doing, though obviously a bit interrupted by the pandemic. So just to explain the calculation that we had in the Lancet series, first of all, down the bottom, we broke research up into 5 stages: the questions that are being asked, the design of the studies to answer those questions, the efficient delivery and regulation of those, this includes ethics and governance, whether people ever publish the research that's done, whether there's an accessible report, even if it's not an open science report, and then the completeness of the reporting of that. Is it sufficient that somebody else can replicate the findings in it? The three that I've highlighted in red were the basis of our calculation. There's good evidence in medicine, at least, that at least 50% of studies have major avoidable design flaws, as in Glenn Begley's blinding problem. Then there's 50% non-publication, and then 50% of studies are unusable because of such poor reporting that nobody would be able to replicate them. And if you multiply those together, you actually end up with 87.5%, but we rounded it to 85%. So I'm just going to go quickly through some of those to understand the problem, but also it helps to understand the nature of the problem in terms of understanding a solution to them. So this is research not being published. This is from some work that Joe Ross in the United States had done based on the clinicaltrials.gov data. And what he found was that overall there was about a 50% non-publication rate, and that was pretty similar across countries, across sample size, across study phase, and across different funders. There are some differences there, but overall the rate is about 50%. And this is for clinical trials. There's now work in other areas, other types of studies that suggest it's pretty similar or even worse in other areas of research. And one of the reasons that he could do this, to even know that this was a problem, is the fact that clinical trials are often registered, and in many countries now it's mandated to have them registered. Without that registration process, you can't ascertain this sort of problem readily. You can get some of it through ethics committees, for example, but not all studies go through ethics committees, and so you can't get them all registered in this way. So people worry about publication bias, but there's also simply a waste here too of unique studies, or the power to look at subgroups or all sorts of things that is just simply a waste, even if it was an unbiased 50%. Okay, the second thing is that new research should build on previous research. And I'm just going to give you one example of this. A woman called Janneke Horn in the Netherlands, who was a stroke researcher, did a randomized trial of a calcium channel blocker called nimodipine in stroke, called the Venus study. And she found no effect of that in her publication in 2001. But she said, well, I wonder if that was the same finding as other studies. Was this replicated by other studies? And so she did a systematic review. In fact, it was preparing this at the same time as the results of the study, and had 28 trials with 7,500 patients. And this showed no effect overall. And the forest plot for this, the meta-analytic plot, is seen on the left here, showing, if anything, a slight increase in the poor outcomes or death at the end of follow-up. So that surprised her. She said, there must have been pretty good animal study models that suggested that this would be worthwhile. Otherwise, why would we have these 28 trials being done in people? And so she did the animal systematic review as well. And of the 20 studies that she found, the review showed no convincing evidence to substantiate the decision to perform trials of nimodipine in larger number of patients. So this is all topsy-turvy. It's the wrong way round. We should have been accumulating the animal model studies and systematically reviewed those before we went on to do the first trials in people, and then checking how well they replicated as we went on and doing a cumulative meta-analysis, or what's now called a living systematic review. And I think the world is moving that way. There are now a lot more animal systematic reviews being done, but at the time Janneke Horn did this, this was actually a very rare thing to do, but it's now a growing field of work. And then finally, the problem of the reporting of research. We've found in a number of areas that that the intervention that is used in trials is usually so poorly reported that commonly no one could replicate it. whether it be a clinician wanting to pick up the treatment or another researcher wanting to replicate that piece of work. And this is one example of it. We looked at the non-drug trials published in the 6 major general medical journals, whom you'd assume would be better than most other journals in picking up on this because they have more careful review processes. And we found that overall we could replicate, there was sufficient detail, 40% of the studies. By writing to authors, we managed to get more of that. We could get it up to 61%, but not from the original reports. And there were lots of things missing, but in fact the most common one was the simple materials, like educational materials, for example, that you would give to the patient as part of the procedure, or an adequate description of the procedure itself. And as a result of that, we added to the so-called consort statement by producing a thing called the Tidier Guide, the template for intervention description and replication, which is designed to fill in the details, to guide somebody through what things you should provide in trying to describe an intervention. It clearly needs to be adapted, and there have been adaptations, for example, for educational interventions or physical interventions or public health interventions. So that's why we called it a template. It was to give the sort of the domains, if you like, that you would want to look at in producing your results, but could be adapted for other areas, but the language often has to change, but not the domains in general. Okay, so looking at that, you might think that's pretty depressing. And in a way it is, that we're losing so much, but we can also think of it as an opportunity, reminding me of the Yes Minister episode where Bernard, the private secretary to the minister, says, Minister, we've got an insoluble problem. And the minister turns to Bernard and says, Bernard, don't call them problems, call them opportunities. And so Bernard said, oh yes, Minister, we have an insoluble opportunity. And it's not quite insoluble, but it is actually a very difficult problem. Otherwise we would have solved it after the Avir Forum said, let's do something about this. This is going to be slow progress. But all that progress is worthwhile. Every time you improve it by 1%, you're saving $1 billion, for example, in global research. So little changes are what's going to happen, but that's going to be a worthwhile thing. And I'm just going to stick up 5 here of things that you might think about. One is just to publish unpublished studies. It's the best way to improve your CV. Second is to reduce inefficiencies and overheads in research. And I'm not going to talk about that in detail, but one way would be to improve the ethics processes in Australia, which are amongst the most onerous in the world. Third is to take up Yannicka Horn's challenge and say, actually, we should do reviews of previous research before new research, but we must make that easier to do. And so we could automate it. We need education and training, and a lot of groups are now working on that, and I'll talk a bit about the UK Reproducibility Network and other educational things that are going on. And then finally, infrastructure for research quality. That includes the registries that I was referring to earlier. And as I say, the NHMRC is looking at this. They're interested in the research culture and how to develop higher quality research through those various stages, looking at better transparency of any NHMRC funded research, which includes registration and reporting of the results of that, accountability mechanisms, and making sure that there's a balance between the breakthrough sort of new innovative stuff, but also recognizing the need for innovation, for replication. That even though it often sounds dull to grant committees, it's actually a very important thing to do. But everyone, I think, on this conference would know that that's actually hard to get funded. People are usually looking for the innovation. And finally, looking at the NHMRC processes to make sure they're more efficient. And some of the things we've done so far is a survey of research cultures in institutions. We're looking at producing something about a guide to study registration. So supporting further the ANZ-CTR, the trials registry that Australia has, but trying to extend the range of studies that may get registered in some place. And in next year's work, we'll be looking particularly at training materials and institutional support. So just to mention a couple of things in those areas, one is the need for rapid reviews to solve Yannicka Horn's stroke review problem. One of the ways to do that is to help develop automation tools to make bringing the literature together easier. So a few years ago, there was the international collaboration for the automation of systematic reviews was started. We've used the tools that have been developed both by us, but also by that international group. We're using tools from all over the world to do our first 2-week systematic review, cutting the time frame down from usually 1 or 2 weeks to do a review down to a 2-week process that totaled about 66 hours. And there's a Twitter handle and a website that's set up for this if you want to find out about those tools. And Justin Clark published with our team on the processes that we used to do that, which included not just the automated review tools, but also a different project management style where we were meeting every morning for about 20 minutes to go through where we were up to that day and having blocked off time, etc. And I won't go through that in detail. It's a developing thing that I think can be extended and adopted to a number of areas. Importantly, not just to get reviews done quickly, but so that we can do them in preparation for new primary research. Some other things that the NHMRC has been looking at, as I mentioned, is the ANZCTR, the Clinical Trials Registry, but looking at what other registries would be available, what other tools would we need to extend in Australia. Others are automated tools that would help in the design process. In fact, the earlier we can go back in that pipeline that I put up, the better things will be. One example of this is the experimental design assistant developed by a group in Edinburgh working on the NC3R project for reproducibility. This is for designing animal studies in particular, but it's a wizard that sort of guides you through that, and then at the end of it, it will write the method section of the paper for you, for your protocol. So it helps both in the productivity, but also particularly in giving you good methods. And the UK has set up a reproducibility network. These are some of the initiatives. This is set up by Marcus Manafo and Malcolm McLeod in Edinburgh and others. And some of the things that they're looking at, which we'll be talking about tomorrow, by the way, are tools for editors, some of them for institutions. There's stuff on registered reports, the reproducibility initiative on journal clubs for early career researchers, and things that institutions might do, and changing the way that people are promoted and what tools are. And so there's local networks that are being set up in the institutions for that. And in Australia, we'll have something which we'll talk about tomorrow, which is the Australian Reproducibility Network, which will be similar and linked to the UK one. So just to finish, what things do we need to change? I think everyone would have a very long list of things that they wish would change in the whole research production. Glenn Begley would say blinding, blinding, blinding. I would say good reporting. Others would say study registration, and you could go down the list of spelling mistakes at the bottom. That's probably the least important, but you've got a long list. But how do we need to prioritize that list, but then we need to think about how to change. And a lovely model for that Brian Nosek talked about when he was at QUT a couple of years ago is this structure of thinking about infrastructure, interface, communities, incentives, and policies that make it possible, make it easy, make it normative, make it more rewarding, and then make it required. And you want to start at the bottom, make it possible first, then make it easy, make it normative, make it rewarding, and then finally you introduce your mandatory policies to pick up the last few stragglers, but don't start there. Okay, and sorry I went a minute or two over time, but I think we've still got time for questions.
Thank you, Paul. There was a quick question from Richard McGee on the chat. He asks about that $85 billion in waste. Is that US dollars or Australian dollars?
It was US dollars, and it's probably more than that actually. At the time, the estimate we had of global research was about $140 million US. It's probably more like 200 million, and about half of that is in the US.
Another question from Jennifer Beaudry. She says about the ARC and NHMRC, are they part of the EVIR Funders Forum? And if so, do you know when they joined?
Yes, the NHMRC is, but it's a health research funders forum. I don't know whether, and maybe somebody knows and they could type it into the chat or the Q&A, whether there's something similar set up in areas in non-healthcare areas. But AVIR is specifically the health funders. So that includes, as I said, the NIHR in the UK, ZonMV, Wellcome Trust is part of it, the Irish funder, and NHMRC signed up, I think, about 2 years ago.
I've got a question. Oh no, we just got another one in from Adrian Barnett, who I think you know. What's the most positive change, Paul, that you've noticed in your time working in this area?
I think I would probably say the degree of awareness and interest. I think we've passed a tipping point, and now this conference, I think, reflects it, that there's just such an interest in it. But some specific things would be, one is the trials registries and a mandate in the United States that you had to, even if you didn't publish the results of your clinical trial, you had to put the results within 12 months into clinicaltrials.gov. And the result of that has been about a 10% increase in the number of results for trials available. There hasn't been a 10% increase in publication, interestingly, but it's a 10% increase in the non-published results being posted. That sounds trivial, but actually that's probably tens of millions of dollars of unavailable research which has become available through that one thing. A second would be, and Adrian could speak to this, is that the ethics processes in many countries have been vastly improved. Adrian has calculated that there's about $160 million waste in Australia because of us using poor ethics processes, that if we copied the low risk procedures that other countries use, we could save $160 million. And some countries have already done that and saved both money and time. And as we saw in the pandemic, they've actually saved being able to do research. I could go on about the recovery trial, for example, which got its ethics approval in 3 days, only had to do it in one of the 132 centres that were recruiting patients, and could not have done it. We could not have done it in Australia. We could not have done the recovery trial because of our ethics procedures. It would have stopped saving lives. Ethics kills. Sorry, that's a
yes, it does.
way of putting it. But the delays in the process and the requirement to repeat it in every centre, that does prevent life-saving research being done.
It's almost killed me, the ethics regime here. Yeah. So thanks, Paul.